Martin Roland, Professor of Health Services Research from the University of Cambridge. Thank you very much for coming in to talk to us. The first question I wanted to ask you is, can you tell me what you understand by the term supply-induced demand?
Well, that is the notion that if you increase the availability of health services, then people will make more use of them. So an example might be NHS 111 or NHS Direct, where we offered a service which was, I think, popular with patients, but overall increased the use that people made of NHS services.
Do you think there's any evidence of supply-induced demand within NHS primary care services?
Yes, I think there is evidence to that effect. Overall, that greater use is made of services when we've provided more services. And that's partly because of duplication. So people go to one, for example, to a new service, and then still end up going to their GP. And then there may be an extent to which, if people can't get easy appointments, for example, with their GP, and they might not have gone at all, but if you provide a new service, then they have the opportunity to make use of that service.
Okay, so complaints about access to general practice are rising, and how do you think we should respond to those frustrations and complaints, given the possibility of supply-induced demand?
Well, we know that the majority of patients get good access to general practice. So complaints are definitely a minority, and I think we need to see what type of care it is that people want to get. And I think there are, if you look, for example, at the National GP Patient Survey, then the greatest cause of complaint is not being able to see a particular doctor for people who have a preference for seeing a particular doctor. So that's one type of access which we know is becoming increasingly problematic. Then there's the issue of whether hours should be extended, or whether what patients want is better access to appointments during regular hours. And I think on the whole the evidence suggests that people want access during regular hours and to a doctor they know, rather than to extended hours, for example at evenings or weekends.
So in your view, what are the most useful or appropriate things the NHS could do to minimise the effects of supply-induced demand?
I think it depends on particularly on which population groups you're trying to help. So, for example, one of the priorities for the NHS at the moment is to improve the care of the very elderly. And the Secretary of State has suggested that all older people should have an individual GP who's responsible overall for their care. So that would be one approach to providing better care, which isn't necessarily more care, but might be more appropriate care. And then we need to deal with how we help people with, for example, young children who get ill. And there you might be looking for a different sort of care, but you'd still probably be looking for care from a skilled person. And one of the things which we've seen in primary care recently is that if you look at the triage, the first person who is first contact in deciding how that call is dealt with, is increasingly somebody with relatively little clinical skill. And I think there's a real question as to whether that's both the most efficient way to respond to that sort of need.
Professor Martin Roland, thank you very much for making those comments.
Thank you.